Chapter 10, the immune and lymphatic system. These are objectives for your chapter. These are your clinical practice objectives when you start your clinical. Bone marrow produces a type of a stem cell that actually produces all types of blood cells, white blood cells, red blood cells, and platelets, which then will differentiate into the cells of the hematologic and the immune systems. B lymphocytes are produced and mature in the bone marrow, and these play a significant role in the humoral immune response. The thymus gland, which is located behind the sternum, is where T lymphocytes mature and then are released into the bloodstream. Lymph nodes and vessels circulate, that is called lymph. It contains nutrients like proteins, glucose, monocytes, and lymphocytes. Lymph nodes are also where most lymphocytes are initially exposed to foreign antigens, like bacteria, fungus, and viruses. Lymph nodes are located near the blood vessels and capillaries. The lymph system removes what is left over after the plasma has delivered all the nutrients necessary to the cells. The lymph fluid actually drains into large veins, blending with plasma that is circulating in the blood. Tonsils and adenoids are lymph tissues that guard the airway from inhaled microbes. The spleen filters blood. This allows lymphocytes to come into contact with any circulating organism, thus activating the appropriate lymphocyte response. The spleen does filter out damaged or old red blood cells, recycling the hemoglobin in the production of bilirubin. Pyropatchers. These are lymph tissue typically found in the ileum portion of the small bowel. These pyropatches help to defend against ingested pathogens. These are the organs of the immune system and the structures of the lymph system. The immune and lymphatic systems work together to guard the body against pathogens and to eliminate pathogens if they manage to pass through the external barriers. The neutrophils and macrophages of the hematologic system assist the immune system by the act of phagocytosis when an antigen is encountered. Chemical mediators, plasma cells, as well as B and T lymphocytes, they play active roles in the immune response. The immune and lymphatic systems work together to guard the body against pathogens and to eliminate them. The neutrophils and macrophages of the hematologic system assist that immune system. Neonates are susceptible to infection because they have an immature immune system. The thymus gland is largest during childhood and adolescence. After adolescence, the thymus gland begins to shrink and its production of the T lymphocytes decreases. The aging process causes our skin to become thin, less elastic, and more prone to injury. Remember, the skin is the first barrier that is encountered by any pathogens. A decreased ciliary action in the respiratory system, as well as the gastrointestinal tract, results in decreased removal of potentially harmful organisms. The presence of chronic diseases can decrease the immune system. Both the immune and the lymphatic systems work together to defend against threats from inside and outside of the body. The blood and the lymphatic systems are constantly protecting against microscopic threats to the homeostasis. Sensory nervous system interacts with the lymphatic system by helping to alert the body to outside physical threats by relaying chemical signals back to the brain. Internally, the blood and lymphatic systems are constantly protecting against microscopic threats to homeostasis. The body wants to maintain its internal stability and its balance. Trauma, pathogenic microorganisms, chemicals, or heat may cause injury to tissues both outside and inside the body. The first step in the body's defensive mechanisms against an invasion is the inflammation or the inflammatory process. The inflammatory response by itself is not adequate in killing the invading organism by creating a hostile environment. The white blood cells, lymphocytes, proteins, and chemicals all respond to internal tissue injury. The immune response is a remarkable series of complex both chemical and mechanical activities that take place in our bodies. These activities involve constant surveillance to detect any foreign agents or antigens as soon as they gain access. They provide immediate recognition of the agents as non-self, meaning that they're foreign or alien, and they provide the ability to distinguish one kind of foreign agent from another, as well as remembering that particular agent if it appears in the body again at a later time. The immediate response is called a humoral response. Humoral refers to any fluids or semifluids, and lymphocytic B cells are key to this response. The lymphocytes that are destined to provide cellular immunity pass through the thymus behind the breastbone and migrate to the lymph tissues throughout the body. These are known as T lymphocytes, and they are further divided into T cells, memory T cells, suppressor T cells, and sensitized T cells or killer cells. T cells provide defense against viral infections. Viruses are often difficult to destroy because they inject themselves into host cells and reproduce. T cells will respond to foreign or abnormal molecules on the surface of any cells. Host cells that contain a virus have small fragments of the virus slightly protruding from the membrane. T cells are able to identify the virus fragment as foreign and kill the host cell. T cells and macrophages produce a variety of substances called lymphokines. These help destroy antigens. Killer T cells will attach themselves to the cells and bearing antigens then secrete toxic substances that kill the antigen-bearing cells. This cell-to-cell contact response is called the cell-mediated immunity or cellular immunity. Immunity is unique. It can be innate or inborn. It features human cells that make a person naturally immune to certain diseases. Humans are immune to some diseases simply by being human and are not susceptible to the same diseases as animals of other species. Some immunity is related to race, gender, or an inherited genetic makeup. Genetic factors present at birth may predispose individuals to immune disorders. Acquired immunity, this is when a person can either actively produce their own antibodies or passively receive antibodies produced by another person or animal. known as passive immunity. Passive natural immunity is the type that is transmitted from the mother to the fetus. Innate immunity is unique or inborn. This will feature human cells that make a person naturally immune. In acquired immunity, a person can either actively produce their own antibodies or passively receive antibodies that have been produced by another person or an animal. Iatrogenic is known as a condition that is caused by a medical treatment. We know that older patients are at risk for problems with immunity because of their decreased immune system. Any consumption of alcohol can alter the person's ability to launch an immune response. Some therapies for asthma, inflammatory disorders, autoimmune disorders, as well as organ transplant are aimed at suppressing or attenuating the body's natural immune responses. One of the more commonly encountered reasons for an alteration in immune function that is not caused by pathogenic factors is iatrogenic. A healthy immune system is a function of a healthy body. Eating right and getting enough sleep and exercise are all important in maintaining resistance to both infection and disease. Frequently skipping meals, eating unhealthy meals, acquiring too little sleep, or not exercising can weaken the immune system and makes individuals more susceptible to pathogens. Immunity from immunizations is usually achieved by administering the vaccine in divided doses over weeks or months. This sets in motion the more powerful, longer-lasting secondary immune responses. This is the secondary immune response and longer-lasting immunity provided by a second injection of an antigen. As nurses, we play a role in providing education regarding the importance of all immunizations. When we do skin testing and we are injecting an immunization agent, precautions need to be taken to ensure that the patient is not hypersensitive to the components of the immunizing agent. Religious orientation is also important to consider because some vaccine products are made using human blood products or pork or bovine material, and they are strictly forbidden by some religious tenets. Common substances used in the manufacturing of vaccines may include chicken embryos, horse or bovine extract, and preservative agents. These substances can produce a serious allergic reaction in people that may be hypersensitive. The immunizing agents that are most often associated with anaphylaxis, a potentially fatal reaction, would include the tetanus, antitoxin, botulism antitoxin, diphtheria, rabies, and anti-lymphocytic. Skin testing is one of the most currently used techniques to measure the immunity and to identify individuals that may have a dormant infectious disease. These tests will include the Schick test to determine susceptibility to diphtheria and the Manitoux test to identify those who might need treatment for tuberculosis. Testing for sensitivity is performed to determine whether a minute amount of the immunizing agent will produce a local reaction. If a reaction does occur, the chances are that the patient will have a severe reaction if the agent is given systemically. An extra precaution to ensure prompt treatment of hypersensitivity reaction is advisable for people receiving immunizing agents to remain in the clinic or the office for 15 to 20 minutes after the injection is provided. This practice is actually in accordance with National Patient Safety Goal of recognizing and quick responding to changes within the patient's condition. A scratch test, which is also known as a prick or a puncture test, involves dropping extracts of allergens into scratches made on the skin. Intradermal injections of allergens are used to detect allergies to insect venom or penicillin. Patches containing allergens that might cause contact dermatitis are placed in direct contact with the skin. Inflammation and itching identify the allergens that provoke the immune system. The complete blood count helps determine whether abnormalities are present in the numbers of the blood cells or types of blood cells. This also allows us to assess the amount of hemoglobin that is present. This information can help us diagnose anemia. The primary use of imaging studies is to identify neoplasms as well as locating and confirming areas of infection. Currently, research is investigating techniques for tagging other cellular components of the immune system with radioactive substances that can then be visualized with nuclear medicine equipment. A CT or computed tomography, MRI, magnetic resonance imaging, and PT, positron emission tomography may all be used to evaluate the thymus gland and other tissue structures of the immune system. PET scanning can be helpful since the technique highlights active metabolic areas when tagged with the appropriate radioactive molecule. A rise in the body temperature will signal a normal immune system response to an infection. Anorexia, or the decreased desire for food, will often accompany fever, infection, and the use of some antimicrobial agents. Adequate amounts of fluid, calories, vitamins, as well as protein are essential to rebuild tissues that are affected by infection and to maintain the immune system. Patients may be immunosuppressed either from the disease process or from medical treatment. The rise in temperature related to a fever is only one component for fighting off the invaders by promoting a hostile environment. Hyperthermia or fever related to infections may cause discomfort, and excessive fever can lead to complications such as seizures. Decreasing the individual's body temperature by physical or pharmaceutical means will promote comfort for them, but may decrease the effectiveness of the body's efforts to eliminate any invading organisms. Excessive fever, known as hyperpyrexia, is usually treated with antipyretics and cooling measures. Patients that are immunosuppressed, this will make the individual highly susceptible to common microorganisms. Patients that must take daily corticosteroids for any reasons, such as asthma or post-organ transplant, are examples of individuals that are immunosuppressed.